Medical authorities in Johannesburg have confirmed the first local fatality linked to a burgeoning international outbreak of Hantavirus, sparking a high-level public health response across South Africa. The victim, identified as a female traveller, died shortly after arriving at a local clinic following an emergency medical evacuation from a cruise ship. This development has placed the city on high alert as officials work to determine the extent of potential exposure within the metropolitan area and among those who shared transit routes with the deceased. While the term quarantine has circulated in local discussions, health officials are currently emphasising targeted surveillance and contact tracing over broad citywide restrictions. The incident is part of a larger cluster involving the MV Hondius, a cruise vessel that was traversing the Atlantic from South America toward Europe. This specific outbreak has drawn intense international scrutiny because laboratory results from the National Institute for Communicable Diseases, or NICD, have identified the pathogen as the Andes strain of Hantavirus. Unlike many other variations of the virus, the Andes strain is documented to have the capacity for human-to-human transmission, though such instances remain statistically rare and typically require prolonged, close physical contact. +3. To understand the gravity of the situation in Johannesburg, it is necessary to examine the nature of hantaviruses. These are a family of viruses spread mainly by rodents, including mice and rats. In most parts of the world, humans become infected by breathing in air contaminated with the virus through aerosolized rodent droppings, urine, or saliva. Once the virus enters the human body, it can lead to two distinct and severe clinical syndromes. In Europe and Asia, it often manifests as hemorrhagic fever with Renal syndrome. However, in the Americas and now appearing in this South African context, the virus more commonly causes hantavirus pulmonary syndrome, a severe and often fatal respiratory disease. The onset of the illness is frequently deceptive, beginning with common flu-like symptoms such as fever, muscle aches, and fatigue. Within a few days, however, the condition can rapidly deteriorate into acute respiratory distress as the lungs fill with fluid, leading to a high mortality rate that the World Health Organization currently estimates at approximately 38% for this specific cluster. +1. The framing of this event as a public health emergency in South Africa stems from the fact that hantavirus is not endemic to the region. The arrival of a highly pathogenic, non-native strain via international travel presents a complex challenge for local diagnostic and containment systems. Public concern has been heightened by the speed of the patient's decline. The victim reportedly began showing gastrointestinal symptoms while on a flight from St. Helena to Johannesburg and died within 24 hours of reaching the hospital. This rapid progression is a hallmark of the Andes strain and underscores why surveillance at major transit hubs like OR Tambo International Airport has been drastically increased. Viewers should understand that while the risk to the general public remains low, according to the Africa CDC, the unusual circumstances of this ship-based outbreak and the confirmed presence of a strain capable of interhuman spread necessitate an aggressive and transparent reporting structure from state health departments. The operational response to the hantavirus fatality has mobilised multiple government agencies, including the South African Department of Health and the National Institute for Communicable Diseases. According to official statements provided to the Portfolio Committee on Health, the primary focus is now on the clinical management of a second patient who remains in critical condition. This individual, a British male, was medically evacuated from Ascension Island and is currently being treated in an intensive care unit at a private facility in Sandton, Johannesburg. The NICD has utilised advanced molecular sequencing and polymerase chain reaction testing to confirm that both the deceased patient and the man in the ICU are infected with the same Andes virus strain. This laboratory confirmation was described by lawmakers as finding a needle in a haystack, given that hantavirus is not a pathogen routinely screened for in South African medical facilities. The diagnostic success has been credited to the country's robust laboratory infrastructure, which was previously bolstered during regional responses to other viral hemorrhagic fevers. +3 detailed travel logs and medical manifests from the MV Hondius reveal a harrowing timeline that health investigators are now piecing together. The vessel departed from Ushuaia, Argentina, in late March 2026, and the first suspected case, a male passenger, died on board on April 11. Because no microbiological tests were performed at the time of the initial death, the body was moved to St. Helena for repatriation, unaware that a highly infectious pathogen might be involved. It was only after the subsequent deterioration of the female passenger during her flight to Johannesburg that the link to hantavirus was established. The Department of Health has since initiated a massive contact tracing operation, identifying 62 individuals who may have had significant exposure to the confirmed cases. Of these, 42 have been successfully traced and are currently under active monitoring. This includes fellow passengers on the flight from St. Helena, medical staff who initially treated the patients without high-level biohazard precautions, and ground crew at the airport. +1, in a briefing to Parliament, Health Minister Dr. Aaron Motsoaledi emphasised that while the situation is serious, there is no verified information to suggest that the virus has moved into the local rodent population or that widespread community transmission is occurring. The minister countered claims of an imminent citywide quarantine by clarifying that current protocols are focused on ring-fencing the known contacts. However, the Department of Transport and Port Health authorities have been criticised by some committee members for the lapse that allowed a symptomatic passenger to board a commercial flight. These agencies are now reviewing communication protocols between international ship operators and local health authorities to ensure that future medical evacuations involving respiratory distress are treated with a higher degree of suspicion from the outset. As the MV Hondius continues its journey toward the Canary Islands under strict isolation protocols, international labs in the Netherlands and Switzerland are also testing samples from other passengers who disembarked earlier in the voyage, highlighting the truly global nature of the surveillance effort. Current public health guidance from the Africa CDC and South African authorities remains focused on two pillars: clinical vigilance and environmental hygiene. For the general population in Johannesburg, the limits of the current risk are clearly defined by the biological nature of the virus. Officials have confirmed that South African rodent species do not naturally carry the Andes strain of Hantavirus, which significantly reduces the likelihood of the virus becoming endemic in the region. Prevention strategies for those in the immediate vicinity of the Sandton Clinic or other suspected sites include avoiding areas where rodent activity is high. Though it is emphasised that the current cases are strictly linked to the maritime outbreak and not to local sanitation issues. In healthcare settings, the focus has shifted to the implementation of rigorous infection prevention and control measures, specifically the use of high-grade personal protective equipment and the isolation of any patient presenting with severe respiratory distress and a history of recent international travel or contact with the cruise ship. +1, despite the transparency from the NICD and the Department of Health, several scientific uncertainties remain. Investigators have yet to determine the original source of the virus on the MV Hondius. It remains unknown whether an infected rodent was present on the vessel or if the initial passenger contracted the virus prior to boarding in Argentina. Furthermore, while the Andes strain is known for human-to-human transmission, the exact environmental conditions on the ship that facilitated the current cluster are still under investigation. Public health officials are urging calm, noting that hantavirus does not spread through the air over long distances like influenza or COVID-19. Instead, it requires very close contact with the bodily fluids or respiratory droplets of an actively ill person. The government has committed to providing regular updates on the status of the 42 traced contacts, none of whom have shown symptoms at the time of the latest report. +2, as the surveillance period continues, the honest limits of current knowledge dictate a cautious approach. While the mortality rate is high for those who develop full-blown pulmonary syndrome, early supportive care in specialised units, like those in Johannesburg, can improve outcomes. The South African government has signalled that it will maintain heightened port-of-entry screenings for the foreseeable future, particularly for vessels and flights originating from South American hubs. This incident serves as a stark reminder of the speed at which rare pathogens can traverse the globe in an interconnected era of tourism and trade. For now, the focus remains on the recovery of the patient in Sandton and the continued monitoring of those in isolation. To stay informed on the latest developments in this and other public health reports, please consider subscribing to the channel for more in-depth coverage. The operational response following the confirmation of the hantavirus fatality has mobilised the highest levels of the South African Department of Health and the National Institute for Communicable Diseases, or NICD. As the deceased patient's clinical history was mapped, it became clear that the timeline of infection began far from the inland streets of Johannesburg. The patient, part of a medical evacuation from a cruise vessel currently traversing the Atlantic, had been transported under emergency protocols that are now being scrutinised for potential lapses in biocontainment. Central to the ongoing investigation is the MV Hondius, a ship that had recently docked in South American ports known for endemic hantavirus activity among local rodent populations. While the vessel itself remains at sea, the focus in Johannesburg has shifted to the specialised biocontainment units where the victim was treated. Medical staff are working under Level 3 and Level 4 biosafety protocols, a necessary precaution given that early diagnostic sequencing suggests the presence of the Andes strain. This specific variation of hantavirus is the only one scientifically documented to allow for person-to-person transmission, a factor that has significantly escalated the level of official concern regarding anyone who shared the victim's transit route or participated in the initial medical intervention in the laboratories of the NICD. Technicians are utilising reverse transcription polymerase chain reaction, or RT-PCR, to confirm the viral load and genetic footprint of the pathogen. This testing is critical because hantavirus symptoms including high fever, severe muscle aches, and sudden gastrointestinal distress closely mimic more common regional illnesses like malaria or severe influenza. However, the rapid progression to hantavirus pulmonary syndrome, characterized by the sudden onset of pulmonary edema where the lungs fill with fluid, is what alerted clinicians to a more rare and dangerous etiology. The laboratory angle is further complicated by the need to rule out other viral hemorrhagic fevers, such as Ebola or Lassa fever, which present similarly in their early stages. Current verified data indicates that while the victim succumbed quickly, the biological samples have provided a clear roadmap for contact traces. They are currently monitoring over 60 individuals, including flight crews and ground-based paramedics, to identify any secondary clusters. This process involves twice-daily temperature checks and the immediate isolation of anyone presenting with even mild respiratory symptoms. The narrative of an imminent citywide quarantine, while prevalent in local media headlines, remains a point of contention between municipal authorities and national health officials. During a press briefing at the provincial health headquarters, spokespeople clarified that there is currently no legal or medical basis for a blanket lockdown of Johannesburg. Instead, the strategy is one of ring-fencing, a surgical approach to quarantine that targets only those with a high probability exposure history. Officials are contrasting these verified containment measures against the social media-driven panic that has suggested the virus is spreading through the city's general rodent population. Virologists note that for a local outbreak to occur, the virus would need to jump from the imported case into local rat or mouse species, a biological hurdle that has not been observed in this instance. Furthermore, the travel and shipping logistics are under intense review. The Department of Transport is investigating the protocols followed during the patient's transfer from the ship to the aircraft and finally to the clinic. International maritime health regulations require strict reporting of any respiratory illness on board, and investigators are seeking to determine if the severity of the outbreak on the MV Hondius was fully disclosed before the evacuation was authorised, as the second patient remains in a critical but stable condition in a Sandton intensive care unit. The clinical focus has turned to the limits of available treatment. There is currently no specific antiviral cure for hantavirus. Management is almost entirely supportive, involving mechanical ventilation and careful fluid management to prevent the worsening of pulmonary edema. The contrast between the official statements of controlled risk and the high visibility presence of hazmat-suited teams at the clinic has created a tension that authorities are struggling to manage. While the labs continue their work to refine the genetic sequencing of the strain, the travel industry is already feeling the impact, with several regional carriers implementing enhanced screening for passengers arriving from Atlantic shipping hubs. The situation remains fluid, as the incubation period for hantavirus can extend up to several weeks, meaning the full scope of this exposure event may not be known until late in the month. For now, the verified evidence points to a contained, albeit high consequence, medical event that has tested the integration of South Africa's maritime, aviation, and clinical health infrastructures. As health officials in Johannesburg continue to manage the fallout from this imported hantavirus fatality, the focus for the public has shifted toward long-term prevention and the practical realities of surveillance. For the residents of Gauteng and the wider South African public, the most critical takeaway is the distinction between the imported Andes strain and the natural ecology of local wildlife. According to the National Institute for Communicable Diseases, or NICD, there is no evidence that South African rodent populations carry this specific pathogen. Therefore, the immediate risk of contracting hantavirus from a local mouse or rat remains negligible. However, as a matter of standard public health preparedness, authorities are using this moment to reinforce general rodent control protocols. The primary method of transmission for hantaviruses is the inhalation of aerosolized particles from rodent urine, droppings, or nesting materials. Public health guidance dictates that if individuals encounter rodent infestations, they should avoid sweeping or vacuuming, which can stir up viral particles into the air. Instead, the recommended wet cleaning method involves soaking the area with a disinfectant or a 10% bleach solution for at least 5 minutes before wiping it down with paper towels. This practical measure effectively deactivates the virus's lipid envelope, rendering it non-infectious. Surveillance at South Africa's ports of entry, including OR Tambo International and the maritime hubs in Cape Town and Durban, has been permanently heightened following this incident. The Department of Health is now collaborating with the Africa CDC to implement a more robust digital health declaration system for travellers arriving from regions where the Andes strain is endemic, such as parts of Chile and Argentina. For those who have recently travelled or were in contact with the MV Hondius, the medical guidance is clear. Monitor for symptoms for a full 21 days, though the incubation period can occasionally extend up to 6 weeks. Key warning signs include a high fever, deep muscle aches, particularly in the large muscle groups of the thighs, hips and back, and sudden fatigue. If these symptoms are followed by a dry cough or shortness of breath, medical attention should be sought immediately, with the patient explicitly disclosing their travel history or potential exposure to ensure that healthcare providers can implement the necessary isolation and high-flow oxygen support as early as possible. The honest limits of our current knowledge are a central theme of this developing story. While the Andes strain is documented to have the capacity for human-to-human transmission, the exact efficiency of this spread in a modern urban or maritime environment is still being studied by international virologists. It is currently unknown whether environmental factors on the cruise ship, such as the ventilation systems or shared dining facilities, played a significant role in the initial cluster. Furthermore, the genetic sequencing of the sample taken in Johannesburg is being compared to South American databases to determine if the virus has undergone any recent mutations that might affect its virulence or transmissibility. This scientific uncertainty necessitates a cautious, data-driven response rather than one based on the rumours of city-wide lockdowns that have circulated online. Officials emphasise that the 62 monitored contacts represent a manageable cohort, and until a secondary local case is confirmed, the threat level to the general metropolitan population remains at its lowest tier. In closing, the ethical dimension of this public health crisis involves a balance between transparency and the prevention of social stigma. Health authorities have urged the public not to stigmatise travellers or the medical facilities involved in the treatment of the victims, noting that vigilance is a collective responsibility. This case serves as a powerful reminder that in a globalized era, a health event in the South Atlantic can have immediate repercussions in a landlocked African metropolis. The success of the response in Johannesburg will ultimately be measured not by the absence of cases, but by the speed and efficacy of the containment and the clarity of the information provided to the public. As the NICD continues its monitoring of the high-risk contacts over the next several weeks, the global medical community is watching closely, learning from South Africa's rapid response infrastructure. For continued, factual updates on this outbreak and other critical public health developments worldwide, consider subscribing to the channel for in-depth reporting.